Hi everyone, my name is Aksenia. I'm PGY2 Internal Medicine resident at NAMC.
And I'm Sangeeta. I'm a PGY1 resident at North Alabama Medical Center.
And we are here to give you some insights about our didactic schedule. First, we have morning reports, which are held every Tuesday, Wednesday, and Thursday from 12 p.m. to 1 p.m., where different residents present interesting cases every day, supervised by our attendings. And we discuss the case starting from how the patient presented, what are the differential diagnoses, what labs did we run, what images we ordered, and how we treated the patients.
And we have Didactic Session, which is a protected learning time that all residents must attend, and it happens every Tuesday, and it starts from 1 p.m. to 5 p.m. And this is actually divided into a 1-hour session where different faculties from super specialties come and teach the residents. Sometimes the co-faculty run important internal medicine topics that the residents should be aware of, and sometimes the resident pick up topics of interest and discusses with the rest of us. And this is a protected time whereby you are off the clinic, you are off super specialty, and you are expected to attend this session every week Tuesday.
We also have Ekg Curriculum, which happens every 2 weeks during the didactic session, and are held by cardiologists.
Every Thursday evening, we run a Harrison Reading Club, which is chaired by our PD, Dr. Chahal. This happens every Thursday at 7:30 to 8:30, and this is a virtual session. It happens, residents join through the Teams meeting, and this is a purely voluntary exercise. Only residents who are free, who are willing to learn, or who are willing to participate in the discussion join. But I can tell you that all of us have been joining it, and it has been a very productive session, and this has been extremely rewarding for whatever sessions that we have attended.
We also have another didactic session called the MK Sub session, which is held by our Associate Program Director, Dr. Anjum. We do MK Sub questions for 1 hour during every didactic sessions every week, and the topic is given to us beforehand 1 week in advance. And it's a lot of fun, and it's super beneficial for our board preparation.
And we also participate in journal clubs that are run by ACOM, and this happens once every month, especially on the Fridays, and it is an afternoon session where the residents join the ACOM team by Zoom, and it happens from 12 to 1 every Friday that it is scheduled.
We are also encouraged to participate in a Zoom meeting, which is called Unremarkable Labs, where super interesting cases are held by UAB residents and faculty. It's basically an online Zoom discussion where everyone can participate, and we are discussing very interesting cases that we meet in our daily practice, and we learn from it.
The other interesting thing that happens is Medical Jeopardy, and we are preparing a team to participate in Medical Jeopardy to represent NAMC. So what happens is once in a while, once in a week, Dr. Chahal actually runs a Jeopardy session, which is like a mock Jeopardy practice, whereby residents play against other residents in teams, and it's more fun, and it's a lot of learning, and it is also something that prepares us for the actual Jeopardy.
And for those of you who are interested in procedure training, we have that too at NAMC during our ICU rotation and when you're on call on the floors. And we have access to arterial lines, central lines, intubation, everything that you can wish for.
The other important thing is NEJM question bank. The program has given each resident access to the NEJM question bank. This is super informative and extremely useful, especially when it comes to board preparation. And it is an expectation that is placed on the resident to go through these questions during our free time. And we are expected to submit a list of learning points at the end of each block, so the faculty actually keeps a track of your progress in terms of learning.
And during our clinic rotation, we have also didactics there as well. We have Yale-based outpatient curriculum, reviews important topics for outpatient medicine.
And we have plans for M&M presentation and grand rounds whereby all the departments meet together and discuss, but this is on hold at this point in time because of the COVID situation. We will resume it once everything is under control, because this is involving a larger group of gathering.
And for those of you who are interested in doing research, there are plenty of opportunities here. We have super interesting cases here in North Alabama. And for the past 4 months that we have been here, our abstracts have already been accepted in various conferences like the SGIM, the Association of Gastroenterology, Nephrology, and American Medical Association.
Residents are also encouraged to participate in various QI projects that are run in the hospital, and there's something called the Research Day, NAMC Research Day, that usually happens around February or March of each year, where we actually get to exhibit our presentations, our posters, and our research work to the rest of the hospital. We also have opportunities to present our research work at other academic centers like UAB, and avenues are being explored to showcase our talent outside of our institution as well. I hope we've given you adequate information that you would need to make a decision about this program, because this is a new program and there is a lot of new opportunities that we are yet to explore, but the current schedule that's in place is to make sure that we come out as outstanding physicians after our training.
We can't wait to meet you all. See you soon.